Today is International Women's Day, and I'm very excited to have two guests at our clinic today, both of them my cousins, د.حورية كاظم, who is a breast surgeon, and هالة كاظم, who's a life educator. And we're all cousins.
And we're all cousins. That's very interesting to have in different kind of fields.
Yeah, I'd like to start off by asking a question.
Yalla.
So we're women working with women.
Yeah.
So, of course, the main question always comes up is how do you balance your family life with your work?
Yalla, حورية.
I'm not sure I found that balance.
Is it even possible?
I don't think so. I think, you have to be organized. And especially when my kids were little, I had a kind of a system where I would try to make sure that when I left the house, everything was organized for the rest of the day. And then that way, when I went to work, I could just concentrate on work. And the same thing, everything would be organized at work by the time I left at the end of the day to go home. Is it perfect? No, it's not a perfect system. And there is so much guilt.
This is the problem.
Yeah.
Is the
guilt.
I don't feel guilty.
No,
I always felt guilty.
I wasn't being a good enough surgeon, or I wasn't being a good enough mother.
You're the best.
No.
Both of you are the best. We don't even go there.
But, it's that feeling that, I should be spending more time as a mother, or I should be But I think, I tried to think that I was spending quality time with my kids. And as I said, when I went home, it was purely for them. I had no life. I wasn't going for, parties or weddings or whatever time I had was then, that was outside of the office would be for the kids. So it's, the balance is actually, that's my balance, whether that's actually
and try to do it without feeling too guilty.
And without,
somehow.
Yeah, exactly.
Yeah.
It's interesting that we always ask a woman
Yes.
if you can balance,
Yes.
and we never ask a man
Yes.
if he can balance.
Yeah, because we're the ones doing the balancing.
Yeah, but then it's
They
not.
don't have anything
a
to
man has to
balance.
do it too. But I think we got into that system that a woman has to do all through generations and generation that we feel subconsciously that we're responsible. Each one of us are responsible, a man and a woman. But when it comes to a woman, for me, I don't think there is anything to do with. You don't even go thinking I have to balance. I think, tell me.
I was going to say that I think in order, alhamdulillah, in terms of, success, and we're all working women and all the rest of it, we have to have supportive husbands. That's one thing. I feel very blessed that I have a supportive husband because I think if you don't, that's the problem.
It is a Women's Day. That's why we're here. And I think a man's part in women's life, like for me, the first thing I do always, I thank my sons and my husband.
But they're with you every day.
For my career.
Yes.
Because if I didn't have an understanding husband, which we all, alhamdulillah, have, and amazing sons, I could have not done it alone.
Yes.
That's true.
So
and I think the support is the important thing. It's not just the support of a husband, obviously that's a big one, and the family, the rest of the family, but even the staff that you hire, because if for me to work, I have to have someone to help at home, and and I think we have to recognize that.
Hello.
So what I always tell people is, hire good people
that you trust
and delegate. Exactly.
And delegate.
So I was very lucky that the person who looked after my first daughter was actually a trained midwife. So she knew medically how to take care of any emergency. She could take initiative, and so when I did leave for work, I knew that the house and the kids were supported by this individual. And I think all these people that we hire play a big role. They're our family at the end of the day.
I'm glad you mentioned that. I remember one time I did a birthday party and I brought my son's nanny, and she didn't know, and I honored her in front of everyone because I told everyone I could have not done it if I didn't have the peace of mind that my son is in the right hand.
Exactly.
Now, I want to say one more thing regarding the question you asked. Each person customize their work according to their lifestyle. Being a doctor,
if they can.
Yeah. We're talking about how we do it. So we did, and we did the best we can. But a doctor is different than a receptionist, is different than like somebody like me, coach, and each field
has its own issues.
Like I travel a lot.
Yeah.
So I have to customize my lifestyle according to the traveling. So I make up when I come back.
Yeah. So I was working in a hospital, and obviously when you're an employee, you have to work a set day. Your day starts at this time, it ends at this time. And when you have children, you need to be flexible as a working mother.
Yeah.
So, I used to get like 2 days notice that my children had some event that they were taking part in. And of course,
especially
as a
in
mother,
school.
Yes, the school used to drive me crazy with that.
The number of emails.
I know. And I'm like, can you all give me at least a week's notice because I've got patients to see. So then I would have to, so that's why I actually went on my own, was I needed the flexibility.
Hello.
But I had that opportunity. So not everybody has that.
I think we're very blessed for that.
Yeah, so
I think for me, I was
that.
blessed because I started late.
Yes, yes.
So even when I had Hassan, I stayed few years doing nothing, just being with him. Then I started my company and my retreats. So that again helped me too.
For sure.
I was done with all the hustle and
I remember one time I had a patient in 3 different hospitals. I had 3 different patients. One patient was in this hospital, the other one that hospital, this hospital. And I had to drop the kids off to school, plus I had to be in the clinic by 9. So I had to see all 3 patients. And I remember at some point saying, okay, I need to figure out a way to simplify my life.
Yes.
I'm going to work through one hospital.
Yes.
That's it,
And I think that's
and I would say, and you have to like prioritize and just make these decisions and go with it. Yeah.
And as I said, we're lucky that we could do that because, if you are a general employee, it's much harder. If you have set hours, it's much harder to then be able to get away for an hour to go see your kids perform on stage or whatever,
I think the fact of feeling guilty, a woman should not dwell on that. You do the best you can, especially if you need the job.
That's good advice.
Give them 2 hours of your time without your phone.
Yes.
Or even an hour.
Yes.
It's better than 8 hours staying home and being on your phone or watching a TV.
Yes.
So, and work is very important for women as well as the men, especially if the family needs 2 people to work.
Yeah.
Yes.
Like it's not a luxury anymore.
Correct.
Although even I think you should, in some form of being busy and using your time in the right way.
So I have one question to ask you guys. Who is your female role model?
Ooh. So probably, I think for all of us, the first female person that we come in contact with and is there for most of our life is our mothers.
Mm-hmm.
I was very lucky. I have still have, mashallah, very, very strong-willed mother.
Yes.
She got married at 16.
She's amazing.
And very, very positive.
She is.
Yeah. And yes, nothing bothers her.
Good for her.
But she used to tell us growing up, no and not possible, those words don't exist in my dictionary. Everything is possible. It just depends what and how much you're willing to sacrifice for it. And she was right.
Yes.
And so I grew up, not knowing really that there were other options in life, that I didn't have to be pushing myself all the time to do things.
But you have the Kaaظm gene, and we have this already.
Yes,
like
yes,
we keep going and doing and pursuing whatever we believe in.
Yeah. So I had it from both sides, but that was a good thing. So I think, I look at Mom, I look at her, getting married early, having kids. She went back to school after getting married, went back to college, trained, and then same issue with being an employee, decided she needed flexibility. She's an artist, she's a fashion designer. So she started her own business and did very well, mashallah, with that.
Mashallah, alhamdulillah.
She's older now, but she has a better social life than I do.
She's still going.
The last time I saw her, she said, "You're the famous because I'm like, yes, I am."
And she's I know. So she's still busy, and I think that is something that keeps me going all the time.
Yes.
And whenever I used to complain, so like during training in surgery, and there are parts of our training, you see us now, and we love what we're doing, but there were a lot of parts in there where you just sort of, oh my God, what have I done? What have I done? And I remember I'd complain to my mother, and she would just say, it's the price you pay for the life you choose. You know, it's basically just get on with it.
Yes.
You know, like, stop complaining.
For me, also, I mean, my mom. Since we were kids, my mom was.
Who's better than Zainab Kaaba?
I know.
Like really,
she always again used to push us. She would always say things like,
gently,
"You can do it." Very gently. You can do it, and yeah, I think, seeing her also working until she was 82.
Yes.
She worked until she was 82. She used to deliver women day and night.
I know. I remember.
Every time we would go to a wedding, we would get a call and we would come back home. And it was okay. That was just the way it was. It was just the way it was.
But she would get up in the middle of the night. I remember that, like almost
years,
every night.
For years.
Just get up in the middle of the night, deliver and go back to sleep.
Yes. And so that was, for me, that is my role model.
I know.
Always.
For me, of course, some of the things was my mother, some of the things, and Elaine.
Yes, Elaine made a big difference in your life.
Kenny is the greatest woman I have ever met, because she's the one helped me change my life. I went to her as a psychotherapist, but then we became friends, and she's my mentor. Now, I look up to her. I'm not denying other women in my life. My grandmother when I was a kid.
We learn something from every woman.
My aunt Shahla, oh my God, I adore her. Khalti, like really, she was a big part of my childhood, and until now, Allah bless her, she is amazing aunt. Like she's my second mother, and she's so loving, and she never left me, always in my good or bad time. And of course, my mother, I learned so many things from her. But again, I cannot take away what I have got from Elaine.
Yes.
Like, she
was pivotal in your life.
And
the change.
She's the one. She was the main change, yes.
Yeah.
And I think you're right, as what you just said, that, we learn something from everybody at different stages of
good
our
or
lives.
bad.
Absolutely.
Good or bad.
Yes.
And the bad, you don't want to do it.
But you learn it. You learn from it.
It's still a lesson.
Absolutely.
Still a lesson.
Everything is a lesson.
Absolutely.
Yeah.
There is a part you said, which I think it's good for us to emphasize, is that not everything we do, we have to love it. Like people think it's, we have the passion and we love what we do. Yes, we do, but
we are blessed. We are blessed.
It's a pain in the neck.
Yeah, sometimes.
And you don't even, how many times you can think, oh my God, what I have done to myself. But then because you love it, it's fine.
Yeah.
But we cannot take away the difficult part of it too. It's not.
And I think that's such an important point, because yes, alhamdulillah, I love what I do now. But we went through 16 years to become
tough.
until I came back to Dubai. 16 years away from my family.
And you've done a good job.
Alhamdulillah.
Yes, I'm the example.
Until I came.
I'm the model.
So everything, even if you're following your passion, there is this road that you have to follow.
Yes.
And you can't break off, Yes, it's hard. Yes, sometimes you think, oh my God, what have I done?
Yeah.
But you have to keep going. You have to keep going. You have to keep going.
And we're lucky that we are working in our passion. But I had a video spoke about this. Not every passion you can live from.
Yes.
You can put it as a part of your life if it's not.
Unless you're lucky to have someone support
like
you.
us.
Yeah.
Okay. But then I don't want to say you have to go only after your passion. No, sometimes your passion, it doesn't make you money. You cannot live from it.
Yes.
You can put it aside and, do your work, even if you don't.
And you
like
have your passion as well on the side. Yeah,
yes.
no, I have friends that are songwriters, but did business because they had a family to support and loved what they were doing, but their real love was songwriting, which you came back to in the end.
Yeah.
What more? Give us
I just
questions.
thought of something and I forgot. It was something about...
I love the way you think, and I love the way I think we come from the same, same school. We're very practical. We're not into La La Land. We don't polish it into like...
A bit too grounded, if you ask me.
Oh, I remember what I wanted to say.
Yeah, tell me.
So one of the things that I found, because people always say to me, oh, you were the country's, first female surgeon.
Yes.
But I was not the first to try. And this is an important point, that there were people before me who wanted to. As we said, the road was very hard and very long. And how we managed to get through was not having other extraneous pressures. What I mean by that is the social pressures. So social pressures, you've got to get married,
we were supported.
you've got to have kids.
Supported.
And so the ones who had tried to do surgery before me had those pressures. You've got to get married, you've got to have 10 children, you've got, seriously.
Yeah, right.
And I can tell you, I mean, I struggled on that road, and the thought of doing that with a husband and children hanging on,
it would have been impossible.
It would have been impossible.
Something would have broken, either the career or the marriage.
Yes.
It was impossible with that schedule to have a family or a marriage. It's impossible.
Those were the sacrifices, as my mom was saying. Everything's obtainable. It depends on what you want to sacrifice. But then coming to the end, so when I needed that flexibility, why was my job not giving me that flexibility? Why could I not? So for example, in other countries, you can have, or our cousin, who's also a doctor in the States, working in a hospital, they had a creche or a baby care center in the hospital. So in her lunch break, in her whatever break, she can go see her baby. She can feed her baby.
Wow, that would have been a luxury.
Some of the places.
I think in the Ministry of Social Affairs,
or
some of these, I think we're doing.
And I think that's a new trend as well. That's a new awareness. It's a new awareness.
But I think it's something that they need to go with.
I think they will.
Make it easy for us to go to follow our passion,
to breastfeed,
to do the things.
to go and see the baby.
Exactly.
Check everything is fine. You miss the baby maybe. Like you may want to go and see the baby.
So I want to go and see my baby. I want to be able to breastfeed. I remember when my baby was little, like every 3 hours having to, express, lock the door in my clinic, express, stick it in the fridge, open the door, see patients, lock the door again. That's crazy. But if my baby was there, that would have been so good. And then I think the other thing was that flexibility in the workplace. If I say, I really need 2 hours because my daughter, okay, she's 4 years old, but she's doing a performance. Mom's got to be there.
Yes.
And I will work 2 hours later tonight or tomorrow or whatever. What's wrong with that? Why does everything have to be, you've got to come at 8 and you've got to leave at 3 and we've got to be, for us,
more
I think
flexible.
For women.
Yeah.
And it's just because we are the moms, we are the childbearer. We're not asking for extra sort of, dispensations.
Absolutely, yes. If someone says to you, would you recommend, like, okay, you're a cosmetic surgeon, but then how far a person can go? Like a woman, let's talk just about a woman like that, because now it's becoming a very common thing, right?
Yes, you mean cosmetic surgery is becoming very common. I don't think there's an answer to that. I think with everything in life, there has to be a balance. And moderation, everything in moderation, and not only in moderation, the question is, how do you define moderation? Because every person has their own moderation.
Yes.
Every person has their own balance. What is normal for me may not be normal for somebody else. So I feel like my role as a plastic surgeon is not to judge anybody coming for plastic surgery. My role is to understand what the issue is, whether it's cosmetic or something deeper. And can I actually help that person, both cosmetically and deeper?
Hello.
Yeah, and I think, part of me, sometimes I feel like my job is I have to be half a psychologist, because you have to feel what's underneath the request.
Absolutely.
What's underneath the request. Having said that, the younger the reality of it is most of my patients come with issues. For example, they've had 5 kids and they come in with very straightforward issues. Every once in a while, someone doesn't, and that's where you have to sort of understand a little bit deeper. The younger generation are much more aware of plastic surgery. They will come to you, they've already got a list. They know exactly what they want. They've already got the befores and afters. This is what I want, And they're more courageous than I would say I certainly was at that age.
Yes.
They're much more courageous.
It's different time, it's different awareness, different.
But again, I would summarize it by saying it's all a balance.
And I think it's very good to check and read and make sure you understand what comes with it.
Yes, what possible complications are there. Choose the right doctor.
choose the right doctor.
Yes, choose the right person for anything, for everything, right? Whether it's a life educator, whether it's a breast surgeon.
But then somebody will say, how would we know this is the right doctor?
You know instinctively. You feel comfortable with that person, you know. And as surgeons, I have to tell you, there are times where I don't want to operate on someone because I can see they don't have confidence in me. And if you don't have confidence in me, then I can't operate, you know. I go into that surgery feeling that I have to be the best person to do this procedure, so you've got to feel that as well, you know? Yeah. And when I see someone kind of like hedging a bit, I actually would rather they went somewhere else. I want you to be confident in me, like I'm confident to operate on you. Yes. You know?
Well, I'm going to ask you a question. I think this is a very good opportunity to sort of talk about breast health. So what are recommendations for mammogram and ultrasound? Something very simple. What is the latest recommendation as to what age one starts?
Oh gosh, well, it's still up in the air. Every country is different. Some countries say you should start doing mammographic screening at 40, some say 45. America says do it every year. Europe says every 2 years. UK says every 3 years. Personally, because I'm a specialist, I actually tailor it to the individual.
And the family.
I look at their family history. I look at what their mammograms look like, because some people have really dense mammograms. So I try to make a screening protocol based on those things, which I think is a bit more scientific. But obviously, when you're talking about population screening, you can't do that. You can't do the individual. So you have to say, like, okay, everybody over 40 gets a mammogram every year or every 2 years, you know?
Okay.
Yeah. So it's, but I think just the awareness should be there, in the sense, not just for the breast. I think one of the things...
Overall health.
Yes, I think overall health. And I think the sense of you knowing your body, you knowing, you know, what is normal for you. So you know when something is off, then you go and do something. We still have a lot of superstition or fear about things, people finding things. I mean, I'm always amazed that people find a lump and then don't do anything for 1.5 years or something.
Wow.
You know, yeah, because, you know, the brain's an amazing thing. You know, you can literally go into denial. I mean, like literally put a block.
You know, and I think, you know, we talk about growth, and we talk about awareness, whether it's health, whether it's emotional growth, spiritual growth. And then also, you know, speaking of growth, I mean, you started this company for women to grow in a very different way than they are used to.
Yes.
Emotionally, intellectually.
Yeah. I love it. I love that. Honestly, I love it. There was such a need for it, and for you to be that person.
Oh, thank you.
Who has changed her whole life herself.
No, honestly, it's been, you know, somebody else couldn't do it. You know, I think about it, honestly.
I think it's been a very interesting journey for me with women, you know. We are very strong. Like, women are so strong, and if we want something, we do it. Yeah. And it's just that we need to believe that you can do it, not the programming that you cannot, you know, or you are limited. Okay, there are things nobody can do it. It's okay, but then I think if a woman really wants to, I think it comes here.
Yeah. And even if they don't want to, I mean, I don't know if I was telling you the last time, but sometimes I get a couple coming in to see me, and the wife will have a new cancer, but a very traditional couple. So you're speaking to the woman, but the husband's doing all the answering. And sometimes I'll say something, so how old were you when you had your first period? And the husband will answer, and I'll look at him, you were there? Like, how do you know that? But what I wanted to say is that they will, the wife will be very sort of, you know, always deferring to the husband, but now she's faced with something that he can't do. I mean, what he's doing actually comes from a place of love and care and support, but he can't do this for her. She's the one with cancer. She's got to go through chemo. She's got to go through surgery. And boy, you should see them at the end of that journey. She will march
just got me the
in to see me, so confident, so like, I've done it, I can do it. She'll leave him out in the waiting room and come in. So amazing. So when you say women are strong, I see it every day.
You have to take control in your hand. It doesn't mean that you have to disconnect yourself from your family, your husband, children, friends. but you have to have the control.
Yes.
Yeah.
I mean, it's
If
your
anything,
life.
those
And I'm
can
not
be
just
your
talking
And
support.
sometimes
about
you have
this.
no choice.
Yeah.
You know, it's not like
Yes.
she wanted to be strong. She had to be strong, and
Yes.
she did it. And
We
she
learn
did
to
it.
depend.
Yeah.
While I think the best relationship is independent, you know, interdependent. Like you have your personality, the person does it their own, and you join together and you have control over your thoughts and life and feelings, which long back now it's changing. Women didn't think they should. And I think change, the hardest change is here.
Yes. Yeah.
So if I were to ask you guys, give me one word to summarize a woman. I'll start with you and then you, and maybe I'll think of something.
So for me, I have to say resilient.
Resilience.
The
is
most
good.
resilient.
Yes.
Woman. I mean, there are so many things about women. It doesn't make men less, just women. I think doing it all. We do everything.
Hey, wait,
Yeah.
that was my line. That's what I wanted to say.
We do everything.
Omnipotent.
I swear
That's
to
the
I was going to
word.
say everything. I was going to say
think
we have everything.
I do everything. I do, like, sometimes I tell my husband and my children, I'm like, if I leave or if I die, how would you
I
survive?
know. I keep telling everybody, like, do it. Everybody can do it.
Yeah.
Take charge.
But yeah, we do it all. I think it comes from multitasking, and I think we've been.
And staying calm through all that.
I know.
Yeah.
I
Having
mean,
to,
you work and you think, my son is doing this, and I have to
Yeah.
organize this. I travel, and I bake enough cookies or cake for my husband, so when I'm not there, and I know that he loves this cookie, he can have it. I mean,
Yeah.
what? See, this is how far we go. I love it.
Yeah.
And I'm not saying it to complain. I'm just saying, look how women,
Are thinking in so
even
many
to
different
something
directions.
so silly.
Yeah.
And one day, and you know, you'll miss it if you don't do it.
Yes.
Right? So it has parts
So
of
what is
you.
your word now?
That was me.
that
was my word.
Yes.
My word was also everything. Like there's
we
a
do
little bit of
everything.
everything in
Yeah.
us. Not necessarily we do everything, but there's a little bit of everything in us. There is a resilience. You have to be resilient. You have to be open. You have to be patient. You have to be multitasking. You have to. So I think there is a little bit of everything.
We're a giver. Like we really give.
Yeah.
And that's where I come from. My work. You give you will give others. It goes in the circle. Because when I smile to you, you smile back, I smile to you. So it is a circle. When I give you, when I give myself and I'm comfortable and happy, I'll give you.
Yes.
And then you give me. It goes.
So you ultimately have to also take care of yourself.
Oh, yeah. That's the main thing.
Yeah.
That's why we come to you.
And that's why I come to you and
come
you
to you.
and everyone. Like, yeah. It's all of
Yes.
us. Yes.
So I wanted to thank you guys for coming here. It was a really lovely
I love it.
conversation. Yeah, I think we can go on forever.
I
We can
know.
keep
And
going.
I'm glad that at least, you know, we have opportunity, cousins, to sit and
Yeah, I know.
discuss.
Yeah.
And it's interesting. You do, you know, breast cancer surgery. You do cosmetic. I go inside of the person, and I think it's such a.
We should start another company.
Yeah.
Three into one. Buy one, get two free. Thank you.
Nice.
Thank you. I
Thank
loved
you.
it.
Thanks.
Yeah,
I
it's
loved
good.
it.
Thank
really.
you.